Good afternoon. I am Donna Arnett, past president of the American Heart Association, and coming to you today on November 10th from the great city of Chicago, where we're starting the American Heart Association. And I'm going to wrap up some of the great science that was presented today. First off this morning was an update for our cholesterol guidelines, and the room was packed, standing room only. And that crowd generated a lot of interesting questions, and I would encourage you to go to the Journal of the American College of Cardiology or Journal Circulation and pull down the new cholesterol guidelines. You can get an executive summary, and you can get the full guideline free at Circulation or JACC. So today had a lot of great science in the space of prevention that I do believe is going to have some major impacts on treatment of cardiovascular disease. The first trial that generated the most interest was a trial called REDUCE-IT. In the REDUCE-IT study, a very specific form of fish oil, specifically EPA, was used, icosapent ethyl. It was used in a very large dose, 4 grams per day, randomized in patients who already had subclinical or clinical cardiovascular disease, or they had diabetes and at least one other major risk factor. All of the individuals on this study were taking statin therapy, and their triglyceride levels were between 150 and 500 milligrams per deciliter. So it's a very common patient seen in clinical practice. So they found that this drug, relative to placebo, had a profound effect on cardiovascular mortality, stroke, and cardiovascular outcomes, with a 25% reduction in risk. Another study on fish oil was a lower dose fish oil. That study is called VITAL. Now it was interesting because it was what's called a factorial study. So they were testing 2 different interventions. One, fish oil, which was just 1 gram a day, and it's that combined fish oil that has DHA and echinociopentoic acid. So it also had, in addition to that drug treatment tested against placebo, another arm that was testing vitamin D supplementation against placebo in a 2x2 factorial design. Now, what was unique about the VITAL study is that study was completely about primary prevention of major cardiovascular disease, and also the incidence of cancer and cancer mortality. So we really expected and we're hopeful that the major outcome of total MI, stroke, and cardiovascular deaths would show an effect of fish oil supplementation, but alas, the findings were null. There was an interesting subgroup finding that showed about a 20% reduction in total MIs in the primary prevention treatment group for fish oil. Interestingly, vitamin D supplementation in people who had fairly normal levels of vitamin D showed no benefit for cardiovascular disease at all. There was a subgroup analysis that showed that vitamin D supplementation reduced cancer mortality, but that's a subgroup analysis, and so more work is needed. One other really interesting phenomenon that they discovered in that trial in the subgroup analyses was that the fish oil supplementation was more effective in African Americans as a group. They worked very hard. Out of their 26,000 patients that they enrolled, over 5,000 were African Americans, and they found that fish oil was more effective in African Americans. They also found that your intake of fish had an effect. So people with a low intake of fish, and that was less than 1.5 servings a week of fish, had a better benefit, as did people with multiple cardiovascular risk factors. So VITAL, a robust null finding for overall total cardiovascular mortality and for cancer incidence. There was no effect. So the last study I'm going to describe is a new study and a new theory around inflammation and treating inflammation that's independent of other conditions. So that study was called CERT. And in the CERT trial, patients were randomized to methotrexate, a drug that's used to treat rheumatoid arthritis. And so that study was stopped prematurely. It was a study with, again, a null finding. So there was no impact of using methotrexate to reduce cardiovascular events in patients who were at high risk for an event. So that wraps up today's biggest science from the American Heart Association. We heard things that really will have an impact on clinical practice, and there are 2 more days of great science to come in the next 2. So look forward to having more great news from the American Heart Association.